Now, can you imagine walking down State Street or walking down 3rd Street today, tomorrow, or the next day and having a guy pull out a gun and kill 8 people and then kill 8 more people the next day and the next day and the next day, even on Saturdays and Sundays, and it goes on and on and on? What's going to happen? This state will be in a state of turmoil. We will be yelling, screaming, jumping up and down, demanding action being taken. Ladies and gentlemen, we have an opioid crisis doing the same thing. 8 people are dying every single day. We're talking about it. We're doing a little thing, putting a Band-Aid here and a Band-Aid there, but we have to do a lot more.
We need a comprehensive approach, something all-encompassing, something that's addressing the needs of first responders, government agencies, including kinship care, up to and including treatment availability.
Those in the Democrat caucus have come up with a package which includes $200 million in funding from the state's rainy day fund to support treatment and local government needs, whether it's for law enforcement, whether it's for additional treatment beds, whether it's for preventative services.
This is an addiction issue, and the opposite of addiction is not just abstinence. The opposite of addiction is connection and relationship, and that's why these human services programs are so important. It's why the need to increase funding for child welfare is so critically important. We have an opportunity with our kids to overcome the challenges and the deficits that they face because they have a parent who is struggling with addiction.
Just a few miles from here, back in January, we contracted to serve about 300 clients a year. When we took it over, it had about 18 clients. Within 90 days, focusing on the opiate epidemic, we're up to about 150 clients. If Medicaid expansion was to go away, which is probably about 2/3 of those clients' means of payment, it would be disastrous.
If we need to start upstream and prevent the circumstances and the conditions in our community that cause people to seek those drugs, that cause them to seek the alcohol. I appreciated that one of our previous speakers mentioned it's not just opiates and heroin, it goes all the way to alcohol and other addictive substances as well. Again, to be a healthy workforce, we cannot be an addicted workforce.
There is not an area in our great state that has been exempt from this crisis. But working together, we have a chance, a real chance, to provide hope to these families, to provide hope to the state of Ohio.